Welcome back to the state of mental health in America. In many cases, the path to feeling better starts with our own actions. Here's how some of you take care of yourself.
Letting people know that it's okay to speak out when you're not feeling right, or search out for help. Don't keep it all bottled in.
I focus a lot on physical health, exercising, spiritual health.
Trying to interact with different types of people, trying to get outside more, trying to stay away from being isolated.
I like playing with my dogs, like listening to music, just doing therapeutic activities after work.
As I'm navigating, my adulthood, I'm trying to figure out what is the good balance. Going to therapy, that is a good balance, right? Having a good support system.
It is also a mindset, and it is a willingness to keep on learning and become better.
Everybody's going through something. So if we could all just give each other grace and give ourselves some grace, especially in these trying times, I think we'd all be better off.
Enjoying the outdoors, listening to music, spending time with loved ones. That's how many of you told us you care for your mental health. Let's go back to Abraham Maslow's triangle to understand what's really going on. It has to do with this section. What you're doing in those moments of self-care to build a greater sense of emotional security. That's one's feeling of stability and confidence and the belief that your emotional needs will be met and respected. We have seen a significant rise in people recognizing that they need emotional and mental health support. It's what NAMI Chief Medical Officer Dr. Ken Duckworth calls the unintended consequences of the pandemic.
So many people were impacted in terms of anxiety, depression, increased substance use. I think more people were willing to talk about mental health, and mental health went from a they thing to a we thing.
Did you hear that? From a they thing to a we thing. The challenges of the pandemic brought people together, pushing us all to be a bit more willing to speak out about mental health. While this has helped chip away at the stigma, it has also exposed a growing challenge: finding mental health care. More than half of the U.S. population lives in an area with a shortage of mental health professionals. The average wait time for services is 48 days. Adding to the challenge, the fact that more than 27 million Americans are uninsured and often face significant financial barriers to getting the help they need. So what do you do when you need help, but that help is out of reach physically or financially? One woman has walked that difficult road herself.
Being of the African American community, this is so taboo to talk about mental health. I am Aisha Gooden Williams. I am a mental health advocate and a mental health coach. And what I do is I build a bridge with community to the mental health resources. Your mental health is your everything. It's a part of my purpose now, is because my mom was bipolar and schizophrenic. And later in life, I had to deal with the childhood trauma of the effects of what we went through as children. This is a picture of my mom at the state hospital. This is me, and this is my twin sister, this is my older sister, and this is my mom. I couldn't remember this moment because I was a toddler, but I remembered how the state hospital looked. I remember the times my mom was there and we couldn't see her, or we didn't understand what was going on. But if I would have had access to more support, and also having the answer to what sick was, because that's all I heard was my mother was sick, but nobody could tell me what the sickness was. So because of the limited access, I have decided to be a bridge. I have decided to be able to openly share my story so others can know that there's still hope out there. People do not even know how to make the proper call when it's dealing with mental health. I rebranded my salon. I added the wellness part, the mental health part, and partnering with licensed professionals I can send my clients to. since it is so hard to sometimes get into places, leading them in the right direction so they won't give up. Oftentimes their access is limited, their funds are limited, their insurance is limited. So we want to make sure we send them to the proper places because we do not want people to give up, not lose their identity. When you're in the middle of a mental health crisis, sometimes you don't even recognize yourself. It's important to me, and it feels so good to me to see somebody get their life back.
We want you to know there is hope. And after the break, we are taking a closer look at how people are doing more than just finding it. They're developing a sense of belonging.